Professor Rachel Jewkes is the Executive Scientist in the Office of the President at the South African Medical Research Council, and her base research work is within the Gender and Health Research Unit. Professor Jewkes is a medical doctor and a social epidemiologist who has led the South African Medical Research Council's Gender-Based Violence Research Program for 30 years. Her research focuses on describing the epidemiology and social and cultural context of gender-based violence, including the male perpetration of rape, particularly its magnitude, drivers, and risk factors. A notable contribution made through her research was developing and demonstrating that male rape perpetration could be studied among men in the general population, thus providing a window on sexual violence acts that are not reported to authorities. Professor Jewkes led this work in South Africa and multi-country research in the Asia and the Pacific region. Her research has described many aspects of the impacts of gender-based violence on women's health and notably elucidated the elevated risk of HIV acquisition among young women experiencing IPV and controlling behavior, as well as post-rape. A major contribution has been in the area of gender-based violence prevention. The SAMRC's Stepping Stone study was the first evaluation of an intervention to show a reduction in male perpetration of IPV. From 2013 to 2020, Professor Jewkes was the Consortium Director of the UK aid-funded What Works to Prevent Violence global program, leading research in the prevention of violence against women and girls in 13 countries of Africa and Asia. This work demonstrated that violence against women is preventable, and that when implemented according to established standards, a range of interventions are effective in preventing gender-based violence, even in very complex settings. Her research has also focused on rape and femicide in South Africa, and with research to bolster the national response and provision of care to rape survivors, including developing the National Healthcare Providers Training Curriculum. She has pioneered work to use epidemiological methods to study the effectiveness of the criminal justice response in South Africa, including national femicide surveillance through repeated surveys. Her current focus is to deepen understanding of risk factors for femicide and the myriad of impacts of IPV on women and their families, including the impacts of help seeking. She is the founding member of the Sexual Violence Research Initiative, which is a networking and information sharing hub in the global gender-based violence field. She served as a secretary for 17 years. She has been A-rated by the NRF over 3 rating cycles since 2011. NRF rating 2011 A2, NRF rating 2016 A1, NRF rating 2023 A1. In 2022, she received the Sexual Violence Research Initiative Trailblazers Award. In 2014, SAMRC Gold Medal. In 2008, the Polgar Prize, Professional Prize for the Best Paper Published in Medical Anthropology Quarterly. In 2000, Millennium Health Award from the Rockefeller Foundation. Professor Jewkes trained as a doctor at St. Thomas's Hospital in London, obtaining an MSc in Community Health in 1991 with distinction. She also completed a master's degree in Community Health with distinction in 1991 at the London School of Hygiene and Tropical Medicine. Completed a Doctor of Medicine degree in 1994, studying through the London School of Hygiene and Tropical Medicine. Professor Jewkes joined the SAMRC in January 1995. She was appointed to head up a women's health research focus. Over the years, collaboratively she has built the women's health focus into the Gender and Health Research Unit, a unit she served as director of for 17 years. In 2013, Professor Jewkes was invited by Professor Slim Abdul Karim to serve as an acting vice president in his revitalization of the SAMRC Executive Management Committee, and continued in that role until September 2014. She rejoined the executive in 2017 and served until January 2022 as Executive Scientist for Research Strategy and Intramural Units.